And your approach is based on learning theory, isn't it?
Yes, if it is true that part of treatment is learning new behaviors, then one could use a learning theory approach to this problem. And if you were to use a learning theory approach, it would then be well to utilize what is current acceptable learning theory, which has to do with reinforcement theory, and thus use a reinforcement therapy or operant conditioning type of therapy. This happens to be the area of expertise of Dr. Ivar Lovaas, who is the director of the project on treatment of childhood schizophrenia.
Is the application of learning theory something new here, Dr. Lovaas?
No. Research on the principles of learning has taken place in every major American university for 50 or more years, so that the principles of learning are relatively well understood, and we have this advantage of being guided by a set of principles that have some clarity. The application of learning principles, though, for treatment and for education of mentally retarded children, that is rather new. It's only a few years ago that Dr. Ted Ayon at Anna State initiated a program based on reinforcement theory for the treatment of abnormal behavior. Since then, we've had a number of programs all over the country, but they still have the quality of inquiry and a quality of research associated with them.
What has this research told us about behavior?
Well, in the most general sense, I would say that behavior which leads to a reward or the termination of stress or discomfort, those behaviors are strengthened. Behaviors which results in no reward at all or discomfort, those behaviors are weakened. So when we structure a treatment program along these lines, what we have done is to actively reward behaviors which we judge to be socially appropriate. And we have not rewarded, and here at NPI we have explored actual discomfort for the patient if he engaged in behaviors which we judge to be socially inappropriate.
Doesn't this mean that you're asking the patient to take on a large responsibility?
It does. And we feel quite strongly that without this responsibility, without the person experiencing the consequences of his behavior would in fact disintegrate, and so would the functioning of the group in which he exists.
As to the patient's accepting responsibility, how does this affect the method of treatment?
Well, the most important aspect of the treatment, I think, would be to define what behaviors it is that you want the patient to be responsible for. And then secondly, what the consequences are that you invoke for those behaviors. The treatment becomes then the structuring of a special environment, a special society.
What will we see here at UCLA?
Well, here you will see the program that we initiated with the four first children that we took into treatment. They are very sick children, profoundly disturbed, and those children who had been in treatment by the time we saw them had not improved with that treatment.